The Food and Drug Administration recently approved a new lens implant that replaces either a cloudy lens or one that's no longer flexible.
And joining us today to tell us more about it is ophthalmologist Dr. Brent Reed of Griffin and Reed Eyecare. Good to have you with us, Dr. Reed.
Thanks, Jen. Good to be here.
This is exciting because people hate having to wear those glasses to be able to read. So how does this work?
Well, this is great news for baby boomers because of the fact that as we get into our late 40s, early 50s, and then especially into our 60s, we can't read anymore. And it's because of the lack of flexibility in the lens in our eye. There have been several lens implants that have come out in the past that have tried to address that problem, but have had problems, significant problems with night halos and glare created because of the way they bend light. This newest lens, called the reSTOR lens, it's by a company, it's pretty well known, Alcon. Actually, it allows people to see distance fairly well, to the point that 80% needed no glasses for distance and no glasses for near after the lens was implanted. And the night halos and glare issue was less of a problem, significantly less of a problem with this lens than in the past. So it's a significant advance, actually.
We've got some pictures up there that maybe you can explain to us the difference between refractive and diffractive here.
On the top, refractive lens implants basically bend light to one point. This lens has multiple zones in it, 12 to be precise, in the center part of the lens, and as a result you actually get two focal points, but they're far enough apart that the patients don't notice that when they're looking in the distance, they don't see any light bending capacity that causes them difficulty in the near range. And when they hold things up close, they can still see clearly. In fact, 80% of them could read phone book size print after they had this done. This actually shows the steps in the lens implant itself as they go from the center out. Some of the steps are smaller than a red blood cell. And that's why the lens is, the technological advance in this lens and the reproducibility to be able to produce these lenses in mass is pretty amazing. And this shows that the number of patients after the lens was implanted that used no glasses at all, 80% basically used them none of the time. And roughly 17% used them part of the time.
Now, could you do this in conjunction with laser surgery?
You could. Typically, this lens won't address astigmatism. So, at least this particular model, they're looking at future models that may. So you'd have to have some form of laser surgery or other surgery that would reduce the astigmatism or eliminate it at the same time, which is very possible. So it may be possible to do this lens implant to restore distance and near vision, and then do a laser touch-up on top of that at a later time in order to eliminate or reduce the astigmatism.
Any other limitations on it?
Well, it actually has a few limitations, Dan, in the sense that one of the major limitations is this is going to be a great blessing to people who have cataracts, but because the lens itself is significantly more, costs more than the Medicare approved amount allowable, Medicare patients who qualify to have cataract surgery will not be allowed to have this lens implant put in because they can't pay the difference for the lens. And I think that the hue and cry will arise, and pretty soon we'll see a change in that policy.
In the last 10 seconds, is there a big difference? What about price on that?
Oh, it's about $900 for this lens versus $50 to $150 for a normal implant.